Murakoze, amazina yanjye nitwa Korukire Noel, ndi umuyobozi w'urugaga rw'abakora imirimo ishamikiye ku buvuzi cyangwa se Chair of the Board of Rwanda Radiology Professionals Council. Uru ni urugaga rero, ni rumwe mu ngaga zigenzura umwuga w'ubuvuzi hano mu Rwanda. Tukaba tureba cyane abakora imirimo ishamikiye ku buvuzi, ni imirimo itandukanye, ni imirimo myinshi. Kugeza ubu ngubu mu rugaga rwacu twandika imyuga cyangwa se profession. Kugeza ubu ngubu dufite profession 22 ku rutonde rw'iyo myuga. Ubu rero muri iyi minsi turi mu gikorwa cyo gusura amashuri yigisha bene iyo myuga. Uyu munsi tukaba twaje hano kuri Mount Kigali University kugira ngo duhure n'abanyeshuri bari muri iyo myuga, kugira tubashishikarize bamenye ikijyanye n'urugaga, ese urugaga rukora iki, kubera iki ruriho, bahurira hehe narwo. Ibi twabiteguye mu rwego rwo kugira ngo tubafashe kugira basobanukirwe, kuko mbere wasangaga baje gukora ibizamini binjiza mu bibahesha uburenganzira bwo gukora umwuga. Tugasanga rero rimwe na rimwe ntibabisobanukiwe hakiri kare. Nibwo habaye inama y'ubutegetsi y'urugaga yanzura yuko hazajyaho kino gikorwa cyo gusura ibigo by'amashuri byigisha bene iyo myuga, tugahura n'abanyeshuri kugira tubaganirize basobanukirwe kurushaho. Ntabwo ari hano honyine rero tubikoze, ko mu minsi ishize twagiye i Huye guhura n'abanyeshuri muri Kaminuza y'u Rwanda ndetse no Kaminuza Gatolika y'u Rwanda nayo iri i Huye. Twahuye kandi n'abanyeshuri biga muri Kibogora Polytechnic muri campus y'u Rusizi, nabo turabaganiriza. Tubona rero iki gikorwa gifite umumaro mwinshi mwiza, kandi kubera yuko bituma abanyeshuri barimo kwiga umwuga basobanukirwa neza imyuga barimo. Tubasobanura ndetse ibijyanye n'amategeko agenga umwuga gusa, ahubwo tujyana n'izindi nzobere muri iyo myuga zayirangijemo, bakabasobanurira umwuga icyo ari cyo, za opportunity zihari, ndetse zaba iz'akazi ndetse n'uburyo bwo kuba bakomeza amasomo muri iyo myuga yabo. Akaba ari igikorwa rero cy'ingirakamaro kirimo kubafasha gusobanukirwa haba ibijyanye n'umwuga ubwawo ndetse n'amategeko agenga umwuga, kugira ngo bazarusheho kuwukora neza. Ikigamijwe ari ukugira ngo babashe guha serivisi nziza ababagana.
Our law, or the role of the council, is to protect the public through regulations. We regulate all those professions. What we want to do is to ensure that all professions, and that is professionals who provide services to clients, patients, are competent. This is why we follow all professions once they join first until they go to the retirement. When you register, you index, we start following you at the university level. Once you graduate, you sit for licensing exam. We give you license to practice. Then you go for practice.
Amazina yanjye nitwa Himbazwe Muvunyi David, nkaba ndi umwe mu banyeshuri bamaze guhabwa ikiganiro na Rwanda Allied Health Professions Council ku bijyanye no kutwigisha kumenya ese Rwanda Allied Health Professions Council ni iki, ese ibyo twahisemo kwiga cyangwa ibyo twahisemo gukora bihuriye hehe, ese niki bidufashe, niki bifasha societe. Yego tugize ibiganiro byiza cyane, baradufashije ko tubashe kumenya byimbitseho ibyo twahisemo gukora. Hanjye niga biomedical cyangwa medical laboratory science, mbashije kumenya ese biomedical laboratory science ni iki, ese ifasha iki societe, ese bihuriye hehe, ese kariyeri yanjye yakura mu buhe buryo. Rero tugize ibihe byiza cyane, turabashimira kubw'umwanya mwanyu muduhaye. Nsoze cyo nababwira nuko ibi biganiro dufashije cyane kandi byari byiza. Nabashikariza ko ibi biganiro bigenda bibaho kenshi kajya gatandukanye, bakomeza kuza kudusura, atari twebwe gusa n'abandi banyeshuri hirya no hino, kugira ngo twese twunguke ubwenge, kugira ngo twese tubashe gukora muri kariyeri zacu. Murakoze cyane.
My name is Valdez Mose Nyasani. I'm from Kenya. I'm a student here at Mount Kigali University, and I'm pursuing a course in the program of dental therapy. I'm in my first year level. So today we had a meeting with the delegates, or rather people from RHPC. It was very interesting, very informative. We were told about our career progressions, and we had, some of our members also had issues or questions to ask. They were answered well. We appreciate the team to coming here and engaging with the students. It was really a good and productive session, I can say. And right now we have cleared some of the queries that we had about our career progression, some of the challenges that we have, and also some of the regulations and requirements that we're supposed to know as students who are doing and pursuing the health sciences. So actually, I have nothing else to comment, but I'm just so glad for this meeting. It has been very informative. So thank you so much, RHPC, and thank you for the engagement I gave today.
Murakoze, nitwa Nkundahezi Polycarpe, nanjye nkaba ndi umwarimu hano muri Mount Kigali University, nkora muri School of Health Sciences, muri Department ya Medical Laboratory Sciences. So twishimiye cyane yuko Rwanda Allied Health Professions Council yaje kudusura ikasobanurira abanyeshuri uko bagomba kwitwara, harimo nanone kandi ethical professionalism, nuko bagomba kwitwara hano ku ishuri batarangiza kwiga. Twashimiye cyane igitekerezo cy'uko abanyeshuri bashobora kujya bakora ibizamini byo kubona license cyangwa se practicing license mbere ko graduatinga, kubera ko natwe biradufasha cyane cyane kuba managing bari kwiga, ko tubigisha natwe effort tugomba gushyiramo kugira ngo tubigishe neza, kandi nanone kandi n'abanyeshuri ubwabo bagira motivation kuko bazi neza yuko hari ikizamini cyabategereje, kandi nanone yuko batazasorigorenga mu gihe bazaba barangije kwiga, bakaba wenda badashobora gukora ibyo bizamini kuko bari hanze, ariko niba bazajya bagraduatinga bafite license, bakaba bafite niyo degree certificate zajya bafasha kwita babona akazi hanze bitasabye gutinda hanze. Rero n'ibindi twashimiye harimo none kandi gukora ubuvugizi cyane ku abanyeshuri bitewe n'amasomo batsinda muri secondary, hari aba rejected kubera ko batize combination zose zisabwa, cyane biology, chemistry na mathematics, cyangwa se biology, chemistry na physics, hari abarize BCG cyangwa se biology, chemistry na geography. Abo ntabwo bajyaga ba admitted, ariko batwishije yuko bagiye dukora ubuvugizi kugira ngo nabo ngabo wenda bashobora kuba admitted kuko barize biology na chemistry kandi barabitsinze. Muri rusange rero twabashimiye cyane abakozi ba RHPC, n'izindi nama nyinshi baduhaye. Hari ibijyanye n'amasomo ya CPDs, uko umunyeshuri ashobora kubona CPDs, hari ibijyanye kandi no ku munyeshuri ashobora kwiyandikisha akiri umunyeshuri, indexing procedures ariyo yanagoranaga cyane ku banyeshuri kwiyandikisha mu buryo bwa indexing. Natwe byatugoraga kuko batugishaga inama bakatubaza ko bagomba kubigenza, ariko baduhaye umucyo, badusobanurira uko bagomba kugenda, kandi umunyeshuri wese yajyanye amakuru azi uko agomba kwiyandikisha mu mezi 3 ya mbere akijoininga university.
Nitwa Associate Professor Uwambaye PC, umwarimu muri Kaminuza y'u Rwanda, nkaba mbarizwa muri Council ya Allied Health Professions Council. Twaje mu gikorwa cyateguwe na Council cyo kumenyekanisha uko Allied Health Professions Council ikora no kuganira n'abanyeshuri ba Mount Kigali University, tubasobanurire ama professions barimo. Nge naje nk'umuntu uhagarariye dentistry, ariko cyane muri dental therapy profession. Hano muri Mount Kigali University harimo abanyeshuri batangiye dental therapy. Twaganiriye n'abanyeshuri, cya gikorwa cyagenze neza. Abanyeshuri bafite amatsiko yo kumenya profession bari kwigamo, ese yatangiye ite, nibarangiza bazakora iki, bazakora he, kugira ngo bazamuke muri kariyeri yabo, bisaba iki, bazazamuka mu zihe professions, mu zihe specialties. Nabonye byari byiza kuko abanyeshuri bari bafite amatsiko yo kubimenya. Twaganiriye, twungurana ibitekerezo. Iyi public lecture izafasha abanyeshuri cyane kuko nk'aba bari mu wa mbere, hari igihe aza mu wa mbere ariko akajya mu kintu atumva neza nko muri porogaramu, ariko iyo baje nk'uku barasobanukirwa, akajya muri porogaramu ayumva neza, avuga ati amasomo yigirwamo n'aya, iyo ndangije nkora iki, iyo nshatse kwisipesiyaliza nkora ibi. Noneho ikindi babigishije, babasobanurira n'ibijyanye na Council uko ikora. Nyuma yo kwiga azaregisiteringa muri Council, azakora ibizamini bya Council. Ni byiza kugira ngo atangire mu wa mbere abizi, akomeze azanarangiza azi ibimutegereje imbere, ibizamini, nindangiza kwiga nzakora iki, n'ibijyanye n'imyitwarire y'umu profession mu by'ubuzima. Twasobanurira n'ibijyanye n'uko umuganga yitwara ate mbona iyi session ni nziza abanyeshuri bose bagombye kuyihabwa.
Everyone, my name is Hannah Adjuri Martin. I am a student from South Sudan. I am doing biomedical laboratory sciences, and today we had a meeting about with the Rwandan Health Alliance. And this meeting was great as it opened up our eyes to understand and see more about what possible more careers we can have after graduation and stuff. And the most things that I liked is that they actually spoke up openly about the challenges that could be faced and how we can overcome these challenges and what and where we can actually try to fit in careers, you know, because as a biomedical science, you would try to think that maybe when I come and join, maybe I'll just be working in the hospitals and that's it. That's like our basic, or that's the limit. I'll just only be in the laboratory in the hospitals, either private or public. But actually, here I've seen that there is actually more of it like in areas of forensic, in areas of pharmaceutical, in areas of biotechnology, and it was an eye-opening. I would like the Rwandan Health Alliances to see, or maybe even ask the students, like let's say the students that were in the meeting, okay, so after you finish, what exactly do you want to do? Is it which field do you want to like divert more, and so that they can help us in it to like walk accordingly to that field. For example, for me, I want to be a biotechnologist. I'm now more interested in it. But now I'm stuck in, I don't know where to start after I finish. So that would be a recommendation for them to try to guide us through the path. And I think that's it. Thank you.
Nitwa Dr. François Xavier Ndayambaje, nkaba ndi umwarimu muri kaminuza y'u Rwanda, nkaba nari specialized muri medical laboratory technology. Twari twaje hano muri Mount Kigali University gusobanurira abanyeshuri biga biomedical science cyangwa se ibyo bita mu Kinyarwanda gupima ibizamini kwa muganga, akamaro k'uwo mwuga mu buzima no mu buvuzi bwa kino gihe bugezweho. Twabasobanuriye akamaro k'uwo mwuga mu buryo butandukanye, ko abaganga ba kino gihe badashobora kumenya indwara batifashije abantu bakora muri uwo mwuga. Kugira ngo ubashe kuvura uburwayi ubwo ari bwo bwose, nuko uba ufite ibisubizo wahawe n'abantu bakora muri laboratoire. Abo bantu kugira ngo bakore muri laboratoire bisaba ko baba bafite ubumenyi buhagije, barabyize neza kandi barabyize mu mashuri afite ibyangombwa byo kwigisha abo bantu, kugira ngo niba bajya batanga ibisubizo by'ukuri kandi koko bifasha abaganga kuvura abarwayi neza. Twasobanuriye abanyeshuri ko iyo barangije icyiciro cya mbere cya kaminuza bashobora no gukomeza bakazagira n'izindi mpamyabumenyi z'ikirenga muri uwo mwuga. Bamwe bakagira ubumenyi buhambaye mu gupima indwara zitandukanye bitewe na specialization bagiye bakora. Turangije tunababwira aho bashobora gukora mu gihe barangije kwiga. Twaberetse ko iyo barangije kwiga bafite amahirwe menshi yo kubona akazi mu bitaro binyuranye, mu mavuriro atandukanye, yaba ayigenga cyangwa se aya leta, ko bashobora gukora mu bigo bitandukanye by'ubushakashatsi, ko bashobora gukora mu nzego nyinshi zijyanye n'ubuzima. Tubabwira yuko ari umwuga abawize abenshi baba bafite amahirwe yegera 100% yo kubona akazi ko kugira ngo ubure akazi warize umwuga bidakunda kubaho. Abanyeshuri rero babyishimiye, batubaza ibibazo bitandukanye, turabasobanurira ku buryo abenshi rwose bavuye hano bamaze kumenya neza akamaro ko gukora kwa muganga, ukora muri laboratoire, bakaba rero bafite amakuru ahagije ku buryo bazajya babasha no gusobanurira barumuna babo bakiri mu masegonderi akamaro ko kwiga laboratoire. Murakoze cyane.
But when you say regulation, please regulate whoever will be coming to practice in the world. So we may get people who went to train in this profession, but who were not trained here to be able to be regulated as well. You understand what is called regulation. So you see, many of them maybe don't know them, but just know that I like the professional class in Rwanda, they regulate both professions. So, what is the purpose of regulation? We regulate to promote the profession and mostly to protect the public. As I told you, we need to make sure that the one who is practicing is not going to cause harm. Is knowledgeable, is skilled to do the work. So now, it's called self-regulation of professionals by professionals for professionals. It means that by professionals who are regulating other professionals. Because these professionals, they know and understand their profession. It means it's not the Ministry of Health that is regulating the profession. But our right, the Ministry of Health is our right ministry. The Ministry of Health will always wait for people who have been went through the assessment and got a license to go to practice. So the Ministry of Health is our right ministry. So when we start regulations start when you start your program. That's why you need to be indexed. That's why we come in here to tell you about regulations. I just want to see how many of you have already got your license, students indexing. Any? Yeah, I see many of you, but there are some who don't have the index number. And you know, according to regulations, you should have and apply for indexing number just after your admission in the university. Then after 3 months, usually you should get penalties. So why do you have to wait? And it's very easy, can be done online. So we have to follow to make sure that people are indexed, to make sure that the criteria for selection have been respected. That's why we come in, and indexing is a requirement from the Higher Education Council. So even the authorities here should encourage students to make sure that they are indexed. Because you can see there are some who are not even aware of this. So students should be indexed. That we help even the government to plan, to know how many people are in the program, and also to make sure that we are monitoring the progress of those students. It's very important to get the data. Welcome, Chair. That's our chairperson. The chairperson of the board, one director of the council, is going to introduce himself once we give you. These are the people who are programmed. No one else is continuing. So I'm saying that council will work with institutions, training institutions, to make sure that students are indexed 3 months after their admission. I just want to tell you that in the next law that is coming out in the near future, there may be penalties applied to those who will be indexing, will be better indexing. So please try to restrict that, and it's not difficult to go on our website. You put everything there, you pay 5,000, and then you register, and then you get your certificate of indexing in your account that you will be when you go on our website, you see follow everything that is done. So the applicant for next number should fulfill all the application criteria as I said, and especially professional executive bodies criteria into a regulated program. That's what I was saying. Now, once you get license indexed, you continue your program. Once you finish, you are going to be assessed together with the school and the council. Just to inform you that it will be that now it used to organize licensing exam, but there is a new guideline from the Ministry of Health that they don't want to delay. You will be having your exams at school. It means once you pass the joint exam, it's a national exam, where the council will be involved and the school. Once you pass that exam, it's the only way you pass that exam that you are going to graduate. That's how it is. You used to graduate and go and sit for exam, for the license exam. Now everything will be together. It means you need to work hard, because if you miss that exam, you will have to sit again after 1 year. So you have to redo and do internship. So make sure that you make sure the council will be involved together with the school to prepare for the final exam. You will be part of it for the core courses, because there are courses that are important for any profession. So these are the courses that you need to know, that they will be telling you for them. These are the core courses will be assessed for the council. Others, there are other courses that are not core courses for the profession, but you need also to fulfill those academic requirements. So make sure that you know immediately when the exam, before the graduation, you will have the exam. Once you qualify the exam, then it's only that you are going to graduate. Certification, when you graduate, you will be completing, you graduate at the same time you get your license. So it won't be a long process to go home and then you forget, or it will be done at school. So is it that okay? It's better. Yeah, that is better. Once you pass the exam, then you get the certificate of registration as a professional. That's what you see, certification of registration in that category of professionals. And then you also get a license to practice. It's different. The registration you get it once, but the license is renewed every 2 years. The registration certificate doesn't allow you to practice. No. But when you pass the exam, you get both. Certificate, you register in the category of dental therapists, practitioners, and then you get a license allowing you to practice your profession in Rwanda, which is renewed. That's what I'm going to put here. That part of being a professional. There are many, but I was saying that you get a license which is renewed every 2 years. In our councils, every 2 years. It's not in our councils. In medical councils, it's 1 every year. In the pharmacy, I think it's also 1 every 1 year. But that's fixed every 2 years. But the law that established the Professional Council, it says that we need to renew our licenses every 2 years. So why do we have to renew our licenses and then get our certificate of professional? It gives you a professional pride. You understand that. Imagine when you qualify, you finish your complete your courses and you get your license. You are proud of being a professional. And it ensures the quality care of patients. As I said, you will be allowed to go to practice and you are sure that this person is competent and is skilled to go and practice and see patients without causing any harm. It also gives you a career development. After a master can go and move, that's what I have here. People with PhDs, they have PhDs too, they have PhDs in your professions. PhDs in dental therapy and medical laboratory. So you see the career progression. Okay? And the assurance of skills and knowledge and job opportunities, of course. You cannot work before you complete your schools. This is about regulations. I said I'll tell you about health regulations. This is our life regulation and when you are at school. But when you complete your course and you get the license to practice, for you to renew every 2 years, you will need to have CPDs grades, the continuing professional development. It's not just if you qualify, you don't need to study anymore. In our council, we require 60 credits and 25 in the ethics. Ethics is very important. There is also another that's going to be compulsory, it's a basic life support, which is the skills you get to intervene. If somebody falls down, they collapse, then you intervene before while waiting for help. So basic life support, which is important for every practitioner in health. So that's why we need 60 credits. And those credits, ethics, basic life support is for all of us. But the rest, which is going to be at around 40, it has to be related to your profession. If I'm a dental therapist, I'm not going to do a course in physiotherapy. No, you can't. But you can have some courses which are cross-cutting. For example, if it is HIV guidelines that everyone should have to know, you can attend that course. You can even attend courses. You are dental therapist, courses organized by dental surgeons because in your domain. You know, these are the examples I want to use. You need 60 credits, you need 60 hours. Your 10 courses can be online, can be face to face. That's why we have professional associations which are responsible for organizing those courses. There are also some independent people, but the council, we only provide, we need that coordinate and provide a certificate to those providers. CDP providers can be a hospital, can be a university like this one like Mount Kenya University, but Kigali University can apply to become a CDP provider, not only for students, even for professionals all around, which is a way of wanting to stay here. You will be willing to stay here. That's what I want to show you now. Why? Because in the East African community, how many countries do we have in the East African community? How many? 7. Who said 7? Who are agree with me? Just for agree that 7. Now, I want to see those who agree with 7. 6. No one 6. 10. 8. So, how many? Do you know that you are in the East African community? Do you know that Rwanda is in the East African community? Where are you from? South Sudan. Is it in the East African community? Yeah? Is it? Yes. So we have 8 countries. It's Rwanda, Burundi, DRC, Kenya, Uganda, Tanzania, Somalia, and South Sudan. 8. So when you say harmonization of health professionals, it's harmonization of training and practice. It means once this process is still ongoing, it's concluded. It's going to allow what we call a free movement of labor. I was saying that you may start here and prefer to stay here, or go back home, or go to work in Somalia, or go to work to Kenya once this process will be completed. Because what we have in the East African community, we have this common market protocol. You need to understand that when you are training, you have a wide market. When you are skilled and you are knowledgeable, that you will be able to work wherever you want when you see that the conditions are better for you. So in this one, we always have 2 parts, and there are 4, but on the main here we have the free movement of goods, which is that. Local things coming from Rwanda can be sold in South Sudan, Tanzania, they bring them, it's okay. But the free movement of labor is still a problem because we don't have this framework. So now, the medical council are very firm, but other professions also have started, which means that we need to work together as professionals to make sure that we meet what we call mutual recognition agreement. So when I qualify here and I want to go to work to Kenya, these are the conditions. When I qualify here, when you have a license to practice here, it's going to be recognized in Uganda, it's going to be recognized in Somalia. So it will be up to you to decide where you want to go. So you see, it gives you opportunities, job opportunities. Don't just look at your small country or your people. No. Think of the wider view of the market that you have in front of you in the near future. So the process has already started. It's going to allow the freedom of movement. So it's about competition and harmonization. Why? It was decided by the Sectoral Council of Ministers of Health in February 2023. Now the process has already started between professionals. And why? These are, it means we'll be looking at the pre-service, it means next how that we plan out to run, and you agree with that. Then you go to the curriculum, the core curriculum, how is it? What are the most important? How many hours we have to run? How many hours we have to do? That's how it works. You go ahead to in-service. Do we have internship? Do others have internship? They need to agree on that. Why? The end of this is this conclusion. As seen above, there are many frameworks that are needed, agreements, protocols, and the support from institutions. This helps to result in easier movement of healthcare workers in the region and get access to quality healthcare services. It is sure that registration licensing is done properly to be expedited. The councils will become stronger, leading to the improvement of training standard and healthcare practitioners. We will be exchanging faculties. If we need lecturers from Kenya, will be able to come here. That's how it is, depending on what the best offer they have. So the harmonization will be now coordination with various training institutions existing in the EMC, both public and private, with a shared vision of training the best in our region. Involvement, there's of course involvement in high level government, the Ministry of Health, the Ministry of Labor, the Higher Education Council, which all those institutions which are make sure that the quality of training and practice is respected. So it's information I wanted to give you. For currently, these are the professions that have already started the process to understand. You can just come for now, because there's another next meeting will be in May. Probably by next year we may have some of them completed the so these have already started by medical laboratory practitioners, clinical officers, physiotherapists, public environmental practitioners, nutrition dietitian, medical emergency practitioners, personal therapists, ophthalmic clinical officers, and for now, these are the categories that have already started. But others also can join. So that's the first meeting that was held in Mombasa. These are the countries that will be present. But others also will join. So it's not like they are excluded. They will join and they will take it as it will be. Because they also bring in their program, they have to go through this process. But at least if you continue with and we complete this process, we'll be able to enlarge our market, our opportunities will increase. Thank you very much for this. I think that's the end of my presentation. And,
I'm called Noé Chile. I'm the chairperson of the board of Rwanda Alliance Professionals Council, RHPC. But my daily work, I'm a faculty member at the University of Rwanda, Faculty of Medicine and Health Sciences, in the Department of Environmental Sciences. I'm a lecturer. The purpose of this visit is just to raise awareness about the council. What's the council? Why council is there? Because we used to meet students at the end of the program when they come for licensing exams. But we realized that this is not a good approach. There is a let's make changes. Instead of meeting graduates at the end of the program when they come to sit for licensing exams, let's meet them when they are still at school level Then we discuss with them, we talk, we exchange ideas about the council, about the licensing exams, and other procedures involved in that process. So this is why we are here, just to make you aware about the council and the process that involved in the licensing procedures. So he said the council, the chairperson, yes, I'm the chairperson. Let me talk about the organs of the council. First of all, the council, I think he talked about it. The council is called Rwanda Alliance Professionals Council, and it has been established in 2013. Now, 12 years of existence. It's not many years, it's not also few years. It's enough, 10 years and above. It's sufficient time for growth and also for doing something. So, the council has been existing from 2013, and the role of the council is to protect the public. When you talk about public, I'm also public, all of us we are public. So, we protect the public through regulation of health professionals. In Rwanda, we have 4 councils: Medical and Dental Council, Nursing Council, Nursing and Midwifery Council, then Rwanda Alliance Professionals Council, and Pharmacy Council, National Pharmacy Council. Currently, we have around 90,000 registrants on our registry. 90,000. Those 90,000 registrants are from different professionals. Actually, this council, RHPC, or Rwanda Alliance Professionals Council, is a complex one because currently we register 22 professionals. You can imagine 22 professionals. Well, medical council, they grade only medical doctors and dental surgeons. Nursing council, they grade nurses and midwives. Pharmacists, they grade only pharmacists. For RHPC, 22 professions. Those 22 professions include the medical laboratory sciences, the medical engineers, dental therapists, environmental health, public health, social workers, physiotherapy, medical imaging, occupational therapy. There are many. I can't talk all, but I think the next presentation will show you all those professions. So, our role, or the role of the council, is to protect the public through regulations. So we regulate all those professions. What we want to do is to ensure that all professions, and these professionals who provide services to clients, patients, are competent. This is why we follow all professionals once they join university until they go to the retirement. When you register, you index, we start following you at the university level. Once you graduate, you sit for licensing exam. We give you license to practice. Then you go for practice. And when you are practicing, we'll be there to follow you. You have to come to renew your license as well as to have those CPD credits. Those CPD credits, a lot of those credits is to ensure that you are still updated in your profession. Because I can be here, I graduate from a medical lab or from dental, then I go for work, 5 years, 10 years, without any training, without any updates. In other words, I'm outdated, isn't it? In that case, you are not providing the current service because you are not updated, isn't it? You are providing outdated services, isn't it? So this is why following from registration and when you register the university, exit, until you go for retirement. In that process by which we protect the public, to ensure that all these professionals, all of these professionals, they are competent from the beginning of the program when they start studying their programs until they go for retirement.
Thank you, Deputy Registrar. As I said, I'm based from the University of Rwanda. I'm also a member of Allied Health Professions Council. I'm a dental therapist by profession and a faculty member at the university. So, just a question of curiosity, who are you a dental therapists? By show of raised hand. Thank you. So maybe from the background of the dental therapy in Rwanda, we did have dental therapy before. It just became, we started dental therapy in 1998, just after the genocide. We had very scarce human resources, including dentistry. Dentists were very, very few. Some people had fled outside, others had died. So we had around 10 dentists in the whole country. So by then, KHI, Kigali Health Institute, started dental therapy program. This is a 4-year program, and just to take care of oral health. Oral health is something very broad. If you understand about oral health, you may think of maybe a good smile or a healthy teeth, but it goes beyond that. So we see the oral diseases, oral cancer, dental caries, periodontology. There are many things that we see in oral health. So by then we started dental therapy program, and someone can say what is pathway to dental therapy. Someone should have at least senior 6 level, A-level certificate, but most especially should have biology and chemistry principal passes. But you can be able to join dental therapy, dentistry generally. So we enrolled students from chemistry, PCB, BCG, whatever, but if you had biology and chemistry, you are eligible to join dental therapy. So in terms of career pathway, after the graduation, we have the package. You have the package to do general dentistry. When we benchmarked in other countries, dental therapy in some other countries is very different from dental therapy in Rwanda. Because of our context and our history, other dental therapists in other countries, they have limited activities. Like they do simple extractions for the serious teeth. They can only do oral hygiene, oral health education, or they can do only the teeth cleaning. But as I told you, we did have enough oral health practitioners by then. So the scope of practice was tailored based on the need of the country. So the dental therapists from Rwanda have a scope of practice that is a bit higher compared to other countries where we benchmarked. So that's why when you go and go to Google and search for dental therapists elsewhere, you will find that their scope of practice is very low as compared to the scope of practice for dental therapists within the country. Since then 1998, we only had only dental therapists. There were no dental surgeons because dental surgery program started in 2013. So we only had dental therapists in the country and very few dentists who had come from outside countries. So the whole general dentistry was being performed by dental therapists. That's why they are given the scope of practice to cover the wide range of activities. So if we say the scope of practice, they do oral surgery, they do simple extractions and other extractions, but not surgical because they don't do surgery. Then they do cavities. Maybe you are in year one, you may not have much knowledge on what they cover in dentistry, but they do restorations, whatever the cavities. Have you ever gone to a dentist? Those who have dental cavities and they have some holes in their teeth, so they do restoration and they do perio and they do some tooth replacements. So the only difference from dental therapists and dental surgeons can go and they can go extra mile and do surgical extractions and do some endodontic treatments, and also they do what we call fixed orthodontics. So whenever you are a dental therapist at a hospital and you receive a patient, you treat, but when you find there are advanced treatment that you are not able to perform, then you can be able to transfer to a dental surgeon or a specialist dentist. So when you talk of career opportunities and career paths, dental therapists, as I said, when you graduate, you are able to perform a wide range of activities in general dentistry, but also if you want to go higher, you can go and do public health, you can do public health dentistry, you can go in academia, you can go in hospital, wherever you want to do, you can go and do research. But recently we have many other dental therapist graduates who are doing specialist dentistry. We have some graduates of orthodontics and we have some who graduate from orthodontics, so they are now opening other opportunities for a dental therapy graduate to do specialty in dentistry. And as far as employability is concerned, I think after we do the end cycle exam and we do the licensing exam, you are in maybe low resource settings. As we said, you have to consult and then take X-ray and then decide. But you may find that in some of the remote hospitals, you don't have X-ray, you don't have enough instruments, you don't have, and you are alone in the hospital. If you face a difficult case, you have to transfer somewhere, and the patient you are transferring maybe is on mutuelle de santé, has no transport. Those challenges, sometimes you are like forced to do it, even if it is not in your scope, and you end up conflicting with the regulatory bodies because you are trying to help the patient because she has no transport or he has no transport to go to Kigali, and you are in a remote setting, and you see that this case is really not yours in your scope of practice. So sometimes we end up doing malpractice, which you shouldn't, but because you are trying to help the patient. So you find yourself alone in the hospital and you don't have enough instruments. You are trying to do your best to satisfy the patient. So those are some challenges that we face as dentists or dental therapists. Also around the region, we don't have dental therapy in East African region. So those who want to go and do upgrading, they sometimes go to China, go to Korea, go to Australia, South Africa. So it's also a shame that we don't have dental therapy in the region. It's also a challenging career path that at UR we are trying to develop some postgraduate programs. Now we are developing dental public health masters, and also we are collaborating with other universities in South Africa to see if they can open for our graduates. Otherwise, if we talk of impact of dental therapy in healthcare, Whenever you go from referral hospitals, district hospitals, up this health center, you will find the therapists practicing and helping the patients. And to our rewards as a dental therapist or dentists, first of all, if you go to health professions like this, you don't aim high on money because it's a challenging job and sometimes not rewarding in terms of finance, but in terms of self-satisfaction. If you see a patient coming with pain or coming with a fractured tooth and you restore that and the patient is going back smiling and you save the life of that patient and the pain is relieved, you feel that satisfaction because you have helped the patient and the patient is satisfied in that way. Otherwise, if you aim for finding money, you do more malpractices because there are many people outside there who are not licensed who just want to do those extractions or those things that they can earn money. But if you go to health, if you are a health professional, usually we don't, our satisfaction is not money. You have to help the human being. Sometimes you work there at night, and the reward is that I said. You have to be, at least you are satisfied that you have helped someone in need. So in terms of ethics, as Registrar talked about, dentistry is a noble profession, and if you have to go to dentistry and you need that respect from the patients, you need to be smart, and you need to have the integrity. If you have ever been to a dentist, you've seen how the dental practitioner is near the patient. So imagine if you are coming for treatment and you are just next to the practitioner and if you feel that smell, however, the bad smell, maybe the clothes are not washed, sometimes you have long nails like this, you have hairstyles that are touching the eyes of the patients. So there are some things that we don't do as dentists or dental practitioners. If you want to go to the dentistry, then you forget about those other fancy things like having long nails, having long hairstyles. So you have to be very smart and focus on the so that you can have that trust of the patient. I don't know if I have tried to. So other satisfaction is also job stabilities, opportunities, like if you want to go to academia, you go to academia, if you want to go to research, if you want to go to the clinic, whatever, you are free to join any career as a dental therapist. So maybe let me wait for the period of answers and questions. We maybe ask us more questions and we'll be able to clarify more about that. Thank you so much for listening.
So, I want to, some of you may know the law of medical laboratory technology, others may not know it. However, for those who doesn't know, biomedical laboratory science is the backbone of modern medicine, where it is the basis of disease detection. For us, lab technicians or lab scientists, we analyze blood, tissue, other biological samples, and other genetic conditions, and metabolic disease, to test all kinds of disease, because modern medicine is founded on knowing the cause of the disease. Without knowing the cause of the disease, you can't treat what you don't know. Before treating, you have to know what you are treating. So to do so, doctors rely on medical laboratory scientists. Either test cancers, infectious disease, and all other disease, we can't do it without
lab technologists. Without the laboratory professionals, medicine would be a guesswork. So doctors would treat what we are going to know. So actually, we are scientists and detectives who provide clarity in certainty. There are many areas of specializations of medical sciences. We have from medical microbiology, which detect fungi, viruses, parasites, and other infectious diseases like COVID-19. And microbiologists play a great role in detecting those kind of infectious diseases. We have some who have specialized in hematology, where they can detect leukemia, anemia, autoimmune disorders by analyzing his blood. We have clinical chemistry, where we detect metabolic diseases like gout, diabetes, and high blood pressure, and the kidney functions or other disorders in the liver. So we can't know what the patient is suffering, especially from metabolic disease, without relying on clinical chemistry using medical lab scientists. We have also who can specialize in immunology for knowing, for example, chronic disease or infectious disease which are immune-based. We have also histopathology, where they can just who specialize in the histopathology and the one who detects all kinds of cancers. You know, currently, infectious diseases are more common in pathology are metabolic disease in cancers. You can't know the cause of the cancer without using people who have specialized in histopathology. We have also people who can specialize in molecular biology, for example, knowing the fertility, doing some forensic laboratory work, like detecting crimes and other technology which like DNA and RNA. To this professional, it has a long pathway, so you can start from diploma or bachelor's degree. Some of you are doing bachelor's in medical laboratory, but for the whole required university, you can do different PhDs or masters and PhDs. And after that, we be licensed to work as a health professionals by this RITC with the one in charge of licensing you to work as a proper lab scientist. This biomedical lab scientist is a good professional. It can open many opportunities for you. Some of you may work in public or private hospitals, clinic, research institutes, and so on. Other people can work in public health laboratories. Other people can work in pharmaceutical or biotechnology companies. Other people can work in the forensic laboratories, like DNA analysis in criminal investigations. Other can work in the academia, like teaching or research universities. Like here in Rwanda, some of you, those who are going to graduate, can work in the Rwanda Forensic Institute. They can work in the Rwanda Bureau of Standards. They can work in the Rwanda Food and Drug Administration. Some of you also can work in the Rwanda Medical Center or Rwanda Medical Supply. Other people, there are still many opportunities, can work in the African Center for Disease and Prevention, African CDC, or World Health Organizations, or partners in. As you can see, this profession is not just a job, it is a mission to save life through sciences. So what the role of this medical laboratory science in healthcare? This medical laboratory science in healthcare, it is very important because it is the one which detects the disease area. Furthermore, you have to ensure safety of yourself and your patients. For example, those who will work in hospitals, for example, if you are going to take a blood, you have to be very careful. First of all, not to infect yourself with blood which contains highly pathogenic pathogens like HIV, but also to protect your patients, in order to not transmit them some infectious disease. Some careless lab technicians can transmit some infectious diseases to the patients when they are not careful. So therefore, this is very mandatory, especially in blood samples in blood collection. When you will be working in hospitals, you will be the one in charge of blood collection and keeping them. We have seen many lab technicians who are some peers where they can easily get some infectious disease or transmit those infectious diseases to the patients. The medical scientists have to adapt to evolving technology. How will you adapt to that evolving technology? You have to always undergo some or get some security or continuous development credits. There are some organizations, companies which can provide some updated knowledge. Don't remain with the knowledge you got from school. Always try to learn every time. They say that learning is a lifetime process. It's to always learn and get new skills and new knowledge. Don't limit yourself to the knowledge you get from school. But despite this challenge, there are many opportunities as I have seen. There are many opportunities for graduates in medical sciences. For example, up to now in Rwanda, there are few jobless graduates in medical sciences. You can be jobless but more than 2 years compared to other professionals where you can spend even 10 years without getting a job. But for lab technicians, it's very hard to miss job. So it is very good job which you can train and be trained for it. So if you have a passion in for science, in the precision and making a difference, biomedical science is really easy for you. This is for the people who like science and precision. So if you are not those people, please join biomedical science. So as a final thought, every single day laboratory professionals save lives without meeting the patients. Behind every diagnosis, every treatment plan, every medical breakthrough, there is laboratory scientists working tirelessly in background. As you know, medical breakthrough or medical research or medical discoveries have come from the work of biomedical scientists. Therefore, I am expecting you, some of you, winning like Nobel Prize by discovering some great discovery like vaccine for different diseases which don't have a vaccine up to now. So I'm expecting you, some of you who are sitting here, one day to make a good discovery which will be good for the world. So what I can finish here, and who have some questions, they can ask questions for some clarification. Otherwise, thank you very much.
Thank you, Dr. Francois. I think medical laboratory scientists are among the frontliners who don't meet patients as he highlighted. Now it's time for question, comment, maybe clarifications.
So, is it possible to proceed to surgery after graduation, like after doing dental therapy? And can we do other courses to proceed to surgery? Then, currently, what are available specialties that we can join? What are specialties that are available in this country? Then number 3, it is what I have for you. In my class, I've been receiving messages from our classmate. He started BCG, so should I admit? But there was a case which arose when they realized that they have admitted someone from BCG. But on the papers of regulations, there was no BCG as combination.
The question is, which operations, as dental therapists, which operations we are allowed to perform after graduation? Because many of them have seen it is special for surgeons, and we are not what our populations from surgeons? Thank you.
So the first one is about the new regulations. So before Health Alliance Professional Council was the one to prepare the examination for students, but nowadays you have changed and you say that the students will be doing those exams before they graduate. Now we want to know, are you still going to conduct that exam and send it to us, or it will be the university to conduct it? The second one is about students. We have a lot of international students, so will it also apply to them before they graduate? Are they also going to do that exam? Thank you.
So we have two programs now in Rwanda. We have dental therapy and we have dental surgery. Each program has its own requirements and its own scope of practice, and also the specialties that align with the program. So for a dental therapist, you cannot proceed from a dental therapy to a specialist surgery, because surgery, if you're going for masters in surgery, that means oral and maxillofacial surgery. This is for dental surgeons, because they are doing bachelor's, now they are doing doctor in dental surgery, and they can be able to proceed to oral and maxillofacial surgery. So the dental therapist cannot proceed to oral and maxillofacial surgery. And you say, what are the available specialists now in Rwanda? Dentistry is still new in Rwanda. We've been having only the undergraduate programs. We have dental therapy, as I said, and dental surgery. We have two postgraduate programs in the pipeline. When fully approved by HEG, they will start in September, and that will be Masters in Dental Public Health and Masters of Oral and Maxillofacial Surgery. As I'm saying, they are still in pipeline under review. We were visited by HEG recently, and we hope they will be fully approved, and we hope to start the two programs in September this year. And then say, which procedures for a dental therapist? Dental therapists, they do almost all procedures, but it depends on the dates. For example, they do surgery, but they do minor surgery. They can do extractions, but not surgical extractions. They can do surgery, and when it comes to advanced surgery, they refer to a dental surgeon or an oral and maxillofacial specialist. They also do restoration. They do all the fillings, class 1, class 2, class 3, class 4, and class 5. That is restorations. But when it comes to endodontics, this is a specialty that is being done by endodontist, which is also a specialist after dental surgery. The dental therapists, they do periodontology. They do periodontal cleaning and for the gingiva and the periodontia. But they also do what we call non-invasive periodontology, and then they don't do surgical periodontology, but they also do perio. They do prosthodontics, this is teeth replacement, but they can do what we call, they don't do fixed prosthodontics. They can do removable prosthodontics of 4 teeth. They don't do fixed prosthodontics because this is done by a prosthodontist, which is also a specialist in dentistry. Canal is what I say is endodontics. It's root canal,
This is being done by someone called endodontist. It's a specialty in dentistry that after they do surgery, they can go for endodontist. So it's being done by endodontist or a trained dental surgeon who is also have that training of doing root canal. Otherwise, it's not something that can be done by a general dentist, whether a dental surgeon or a dental therapist, because it's a specialty treatment.
Yeah, because it may happen, normally this combination of biology and chemistry is allowed by higher education council. But of course, there are weight, marks. You must have, if it is BCG, you must have some marks in biology, some marks in chemistry. There are limits. If you have low marks, of course you can't be allowed, even if you have this combination. So I think this is a special case, or particular case, that they need particular discussions. It's not common because normally the people with this combination, which are biology and chemistry, are allowed by high education council. But of course, you have to consider those levels, those marks. This is what I can say in that. Then there is another question which was about the license recognition outside Rwanda. Yes. Yeah, actually, registrar talked about the harmonization of the curriculum and the mutual recognition, right? So for us in Rwanda, when you come from outside with your license, let's say you are from South Sudan, and you have your license from South Sudan, when you come here in Rwanda, what we do is just to verify if the license is genuine. Then we give you our local license without any other requirements or instructions. So, but what we need here is through that mutual recognition agreement is that if you graduate from here, or if you graduate from Kenya, from Tanzania, from Uganda, all countries in the East African community, is that we recognize your credentials, right? So far, I don't know if South Sudan recognize licenses from Rwanda, but for us in Alliance Professionals Council, if someone comes from East African countries, we recognize their documents. Of course, we have to check if they are genuine or not. Then that even if we recognize documents, there are of course some requirements. You have fees to pay. You have to check your degree, kind of document to check and pay me. You can't come with your license. You have license. Please recognize it. No, you bring your license because you have to check your degrees. You have to pay some fees, and we give you our local license. Because the law here in Uganda, the regulation says that you can't work in Rwanda without the license. Then another question was about if the council organizes CPD courses or workshops. No, the council does not organize workshop or training or CPD courses. What do? We accredit, the council accredits institutions to provide CPD courses. For instance, Mount Kigali University, they apply to be a CPD provider. The university will apply through the council. The council approve.
The exam will be conducted at that school. Once they change, the feasibility also will change. It's a recommendation that has been coming from the higher level, the Ministry of Health and Education. Once they have been analyzed the feasibility, you will be informed through your university. think if there is no other question.
Some of these students. I first want to thank you for a very good discussion. Starting from, you discussed how many we have medical laboratory or Rwanda Allied Health Practice Council, Professional Council. Then we have pharmacy, we have medical for doctors. But when it comes to disease management and implementation, we have seen this One Health approach, that where we need all the professionals to come together. And we can see like some countries, they can vet working at hospital because of the increase in zoonotic diseases. So what is the approach of the council toward the One Health approach in disease management and prevention? Yes, thank you so much. That's my question.
I think this one health approach, it's somehow interlinked with the interprofessional collaboration that the literature has been presenting. With this collaboration of all health professionals or other professionals who are involved in One Health, the council really encourages that people can be collaborating for this purpose of One Health. One umbrella. There is an umbrella. The council is not a training institution, but it encourages with these interprofessional collaboration. Whether there is the higher learning institution can include the One Health concept in their training, the council accredits this program. Once there is a workshop or training where they want to train people, health professionals in various professionals on One Health, the council accredits where the course or the workshop. That's where the council comes. And the other issue or the other aspect is advocacy. Sometimes the council advocate for this concept for the improvement or the protection of the public. That's where the council is involved, but directly, as the council is not a training institution, it's not really directly involved in One Health concept.
There's one question that was not answered. The question from Leng, he asked about how many subjects that will be taken in the exam if they remain the same subjects that other exams used to be. And also the question from Cluster of Dental Therapist, he asked, I don't know if the question was addressed efficiently, I don't know, because I think what he asked was that the person was rejected. Is it because of the marks or grade, or is it because of the geography that is there, but not math or physics? I think Chairperson addressed it in terms of marks, press report. The questions can be addressed.
As he said, I think it's a particular case that can be discussed with analyzing the real marks of this applicant or this student, because it's not general. It's a specific case that can be discussed on the basis of how or his document. That's what I can respond. The other thing on subject, normally for the register exam, we have some thematic area that we examine. Like in the medical laboratory, we have 4 papers. The one is hematology and immunology, microbiology, clinical chemistry, and the histopathology. And in the other field, they have their specific. You know, we have more than 20 professions. Once you are eligible for exam, we give timetable with a specific courses that you will be subjected for exam. With the new guidelines, they will look on everything, even the core module or core courses that will be examined or that will be subjected in this exam, because we are still looking whether this exam will be final, set by the university or set by the council or set by another committee from the ministry or from elsewhere, because this is a recommendation that comes from the higher level, as I said. And once they finish with analyzing all these issues, your university will be communicated. Because from what we heard from the ministry is that once you leave the school, you will go with your degree and the license. I think all that will be examined.
When I go back to BCG, maybe we may not have cleared this. I say the two principal passes, chemistry and biology, but we need to verify in the entry requirements if geography is there. That's we have to verify. Otherwise, but I'm very sure you have to have the two principal passes in chemistry and biology, but geography we need to verify the entry requirements if it is included.
Maybe what they can clarify for professionals, if you have done any combination containing chemistry and biology, and you have to place passes in those in chemistry and biology, whether it contains geography, mathematics, or the others, as long as it contains chemistry and biology, you are allowed. If it has not been put there, it may be due to a mission which can be verified and confirmed by the Higher Education Council.
For your own information, that even these criteria from HEC, they are changing. We will have a meeting next week where they will be communicating us how we will be looking at these criteria for indexing, including the pass mark. Since this year, whether it is not last year, things have been changing. And I think the HEC has been releasing public communique saying that these criteria for entry in the university will be changing. I think also this issue of communication will be highlighted also.
Thank you so much. Do you have more questions?
If someone is interested in forensic sciences, maybe in master's or advanced levels, do we have such an institution in Rwanda that provides such maybe degrees in forensic sciences here in Rwanda, or is it not available here? Maybe someone has to go and study outside and come back, maybe to work or something. So I was asking myself, is that kind of education here in our country, available in our country, in forensic sciences? Thank you.
Yeah, thank you very much for your question. Currently, we have the Rwanda Forensic Institute. It mostly employs people who have done specialties in molecular biology, but currently we don't have a specific training either at master's level or at bachelor's level, which is specialized in the forensic science. If you want to specialize, you can do this. There are some countries like UK where you can get such specific specializations. However, if you have done molecular biology, you need some minor trainings like in genomics, like in forensic science, to be employed there. Most of the people are employed at the forensic laboratories at Kigali. Most of them they have specialized in the molecular biology, or some of them in medical microbiology. So don't worry if you happen to specialize in molecular biology, you will be welcome to forensic science, and you will get some trainings, minor trainings to be employed there. Thank you.
so much for your questions, those who have participated in asking questions, and the answers provided. They are really wonderful.